My name is Kosi. I'm a student of Kosi State Medical University, Russia. I'm first year medical student. I'm in group 4. She was given a project or a kind of assignment to conduct a demonstration on medical malpractice. First of all, before going on, I would like to define what is medical malpractice. Medical malpractice is an action or omission by a healthcare provider which falls well below the acceptable standard of care that other healthcare providers will have given under the same circumstance or under the same condition, resulting in injury to the patient. First of all, two conditions must exist for a valid malpractice case. A healthcare provider gave treatment. It's either a healthcare provider gave treatment below the standard of care, or that the provider's action or inaction resulted in a verifiable serious injury. Then, first of all, we go to examples of medical malpractice. First example is prescription error. For example, a patient has been coughing for some days and he went to see a doctor and he went to see a primary care physician. But before seeing the doctor, he filled a medical questionnaire. In that medical questionnaire, in the allergic list, he filled that he's allergic to codeine, meaning that he doesn't take codeine. Then the medical doctor, after going through the whole questionnaire, after going through the allergic list and everything, still prescribed Tylenol-3 for him, knowing fully well that Tylenol-3, the primary ingredient of Tylenol-3 is codeine. It is a medical malpractice because the patient, after taking that Tylenol-3, will develop some allergies, which will, at the end of the day, cause one harm or the other to the patient. Then we have other types of another type of medical malpractice is a situation where a medical practitioner, it could be a doctor, it could be a nurse, or any form of medical practitioner that is found insulting a patient or treating a patient abnormally. That is a medical malpractice. And I will show a video of where it happened in USA. If you look at the video, it's part of the demonstration of medical malpractice. Thanks.
We do begin this half hour with the patient accusing the doctor of some bad bedside behavior, and it was all caught on camera.
That patient complaining the doctor was physically and verbally abusive, refusing to believe he was suffering, even cursing at him. ABC's Marcy Gonzalez is in our LA bureau with the story. Marcy, good morning.
Dan and Paula, good morning. That patient says the doctor accused him of going to the hospital in hopes of getting narcotics, and that, he believes, is what set her off. He tells us he was simply seeking treatment for what turned out to be an extreme anxiety attack, and he is still baffled by what happened next.
Sit up. Sit up.
Dude,
sit up. Sit up. I'm having you sit up.
I can't get up.
This morning, this emergency room doctor banned from working in this Northern California hospital after she was caught on camera mocking and cursing at one of her patients.
I knew from when she said something to the security guard, I already knew from that point. I said, "Hey, Dad, can you please take out your phone? I need you to take out your phone now because I have a feeling something's going to happen."
If I could get up off this chair, I really would. But
yeah,
I can't.
You really should, because this is ridiculous.
I can't, and you're not going to keep tugging.
Samuel Bardwell says he was rushed by ambulance to El Camino Hospital after collapsing during basketball practice Monday, after waiting more than 3 hours to be seen.
I'm sorry, sir. You were the least sick of all the people who are here who are dying.
He says he told the doctor he was numb, in extreme pain, and having trouble breathing.
I just tried to inhale, and I even told her I could not inhale.
He can't inhale. Wow. He must be dead. Are you dead, sir? I don't understand. You are breathing just fine.
This is not...
Bardwell tells ABC from there the tension with Dr. Beth Keegstra escalated unprovoked.
No, you have changed your story every time.
Whoa.
The hospital CEO saying in a statement that the physician's demeanor was unprofessional and not the standard we require of all who provide care through El Camino Hospital. We've expressed our sincere apologies and are working directly with the patient on this matter.
In my mind, I don't think she should be practicing medicine at all, because if it's not a race thing and she treats everybody that way, then that's a problem.
And the CEO of the hospital group went on to say the doctor will never be allowed to work at any branches of the hospital group again.